Good morning, friends. So there was some technical glitch, so we are starting from the beginning again. Yes. So we start with the first question in psychiatry, that is, who coined the term psychiatry? Johann Christian Rale. Johann as Jihan, Christian, the sign of Christianity, Rale, the train. So Johann Christian Rale coined the term psychiatry. This is the person who coined the term psychiatry. So this is a picture mnemonic, and you will remember because I started with this statement, psychiatry, with Johann Christian Rale. Johann as Jihan, Christian sign of Christianity, and Rale. Johann Christian Rale coined the term psychiatry. Not Sigmund Freud, Nitin. Sigmund Freud is father of psychoanalysis. Okay. Yes, we will discuss Sigmund Freud in detail. Freudian theory, so many questions are asked, but psychiatry term was coined by Johann Christian Rale. Yes, one more mnemonic, yes, that rat syndrome. Rat syndrome. Whenever you will find a question on rat syndrome, you will find that rat is having very small head. So, microcephaly. Microcephaly. So I will discuss, yes, I will discuss all these disorder in detail, rat syndrome, autism, but for the time being, just to appreciate, yes, how the mind can work faster and how we can recall better in our exam. Okay, these are the few techniques. So autism, I usually say autism as auto. Auto is mainly run by male, so autism is more common in male than female. And if I see autism, auto, he's having 3 tires. Auto is having 3 tires. So age criteria of autism is 3 years according to ICD 10. Question has been asked. Autism criteria, age criteria is 3 years, and in autism there are 3 criterias. How many criterias? 3 symptoms criterias, 3 criteria. What are these 3 criteria? Let me show you. Yes, again I repeat, I will discuss all these things in detail, just introducing how psychiatry will go, how concepts will go, how my mnemonic will go. Okay. Suppose a child is sitting, autistic child, you must have not seen autistic child. Yes. Suppose an autistic child is sitting, he is sitting alone. He is not interacting to anybody. No interaction, no eye-to-eye contact. He is lost in his own world and doing like this. No verbal communication. Means you will find that autism, if you want to make the diagnosis of autism, the child should have no language development, no social interaction, means no eye-to-eye contact, and this stereotypic movement. This is called stereotypic movement. So 3 criterias. Even if you don't remember, it's okay, I will discuss in detail. Yes, 3 criteria, 3 years. Yes, more common in male. So we can say that 33% patient of autism have mental retardation, may have mental retardation. 33% patient. Okay, we found that autism, yes, is associated with MMR vaccine. So you can easily correlate MMR vaccine. So previously there was a publication, there was a paper, according to that autism occurred due to MMR vaccine. But later on this theory was discarded. But even now question is asked, which vaccine or MMR vaccine is associated with which psychiatric disorder, which childhood psychiatric disorder, and the answer is autism. Now there is a story mnemonic. Question is asked that autism is associated with, yes, tuberous sclerosis. Autism is associated with Fragile X syndrome. autism is associated with phenylketonuria. Means we found that the patient of tuberous sclerosis may have autism. Fragile X may have autism. Phenylketonuria may have autism. Congenital rubella patient may have autism. So, yes, how to remember by story mnemonic? Suppose there was a auto. Yes, in this auto puncture occurred. When puncture occurred, the tube is constricted. Constriction means sclerosis. Yes, tube is sclerosed. So puncture occurred, tuberous sclerosis, tube is sclerosed. Now you want to correct this puncture, so you will use jack, and jack looks like X, and this X is moving, fragile X, fragile X. Now is a COVID pandemic. In COVID pandemic, this auto driver can't afford sanitizer, so he keep phenyl bottle, the phenylketone urea, and in place of horn he keeps bell. He keeps bell in his auto, bella, congenital rubella, bell. So congenital rubella is associated with autism, tuberous sclerosis is associated with autism, fragile X is associated with autism, phenylketonuria is associated with autism. So these are few questions which are asked which have no concept. You can remember them by mnemonic. This is autism awareness ribbon, no question till now, but they have asked many times about autism, so they can ask next question. Autism awareness ribbon. Now, one more mnemonic, that is interesting mnemonic. Yes, you all know that you talked about Sigmund Freud, Nitin. Yes, so I will comment something about Sigmund Freud. Yes, he was the person who, yes, who was the, Sigmund Freud was the first person who introduced cocaine in psychiatry. Who introduced, bottle de dena hai na? Thank you. Who introduced cocaine in psychiatry? Yes, and it is said that Sigmund Freud was addicted to cocaine. Cocaine, I usually say, remember, make mnemonic by the color, by name, just like cocaine. Cocaine as Coca-Cola. Cocaine as Coca-Cola, and it is a fact that previously cocaine was present in Coca-Cola when cocaine was legal. But now it is not there. What is the color of Coca-Cola? It is blackish brown. We found that the person who use cocaine, they have jet black tongue. Jet black tongue. This is the favorite question of MCI, that jet black tongue is due to, yes, which substance? That is cocaine. And cocaine, coca, in Punjabi, you know, coca nose pin is called coca. So by the name itself you can make many mnemonic. Coca, ni tera coca, there is a song, okay, and we wear cocaine, coca, not cocaine, coca at different place nowadays. Suppose this girl is wearing coca at nasal septum, so there would be nasal septal perforation, nasal septal perforation. So cocaine use is associated with nasal septal perforation. Cocaine can be, yes, matching with cockroach. So sometimes patient taking cocaine feel as if cockroach is crawling under the skin. Feel means touch, and actually there is no cockroach, and patient is feeling cockroach crawling under the skin. That's why it is called tactile hallucination. We will discuss in detail. So by the name you can make merry mnemonic. Yes, we will discuss hitchkey, clozapine and other things also, but now I'm going conceptual. So this was introductory part. Yes, how we will go in psychiatry with the help of mnemonic also. And the best thing is that you can make mnemonic in other subjects also. Okay, so we start conceptual part now. Okay, there was some disturbance and this is always there in our life, but we should not stop or we should not be worried about these small glitches in technical issues and in life. Yes, I will tell, because you know that when we prepare for any exam, every time you will find so many obstacles. So but never ever afraid of these obstacles. Okay, this is my personal advice. So we start. So in psychiatry, we will remember in the story form and you will never forget. Yes, suppose a patient comes to you in psychiatry. He is having suspiciousness over family member, that my family member wants to kill me. Yes, it's a frequent presentation in psychiatric ward. You are sitting in psychiatry OPD, psychiatry ward, and a patient came and he's saying, Doctor Sahab, you know that my family member wants to kill me. Actually, nobody is going to kill him, but he has suspicion over family member that my family member wants to kill me. This is called delusion. I will discuss later. For the time being, he is having suspiciousness over family member. My family member wants to kill me. And he sometimes hear voices when no one is around. Means there is nobody is speaking, but he hears voices that yes, your family member wants to kill you. Means he is hearing voices, he is having suspiciousness, came to you. You ask, yes, what is your problem? The patient would say, Doctor Saab, I am having no problem. I am absolutely fine. My family member wants to kill me. My family member wants to kill me. Means he would not give you the proper history. So you will take the history from the accompanying person, and that is called informant. That is called informant. Means many times you will find that psychiatric patient will give history that is not sufficient. That's why we take history from the accompanying person who is coming with the patient, and we say, yes, usually in medicine surgery we say attendant, but in psychiatry we use the word, what is the, yes, this is called informant. Okay, this is called informant. Now, this informant may have some malintention. This informant may have some malintention. Yes, let me tell you. Yes, that's why when we take history from the informant, yes, we should check the reliability of informant. What I said, informant should be reliable. Informant should be reliable. Okay, sometimes why we are so much concerned about the reliability? Many times what happens that the informant, means family member, want to take the property of the person and they want to declare that person is mentally unstable, he can't take care of his property, that's why that this property should be, yes, power of attorney should be given to the relative. So means informant should not have any malintention. So you are psychiatrist, you are sitting in OPD, patient came to you and he says that my family member wants to take my property, my family member wants to kill me. It may be true and it may be his suspicion. So how you will confirm? Yes, we check the reliability of informant by 5C. Yes, 5C. I will give answer to all your question when we will discuss, yes, substance use disorder. Okay. I will show you the diagram also. Okay. Chronological, coherence, consistency, closeness, and concern. Chronological, coherence, consistency, closeness, concern. Is what is chronological? I give you example and then you will appreciate. Suppose a 23-year-old girl married 2 years back, living with in-laws, was brought by her father. Means father brought the patient, a 23-year-old married girl. Okay. Each and every line is important. Each and every line will give you the question. Okay. Her father gave history. Means informant is her father. Informant is her father. Informant is father. That she started having suspiciousness over family members for last 6 months. Means she is suspicious of family member for last how much duration? 6 months. Yes, please do remember these examples also. I am going very slow in the initial. Gradually I will increase the speed. Don't worry. Okay. For last 3 months, patient also report hearing of voices when there is no one around. Hearing of voices when there is nobody around, no one around, is called hallucination. Is called hallucination. I will discuss hallucination in detail. Actually, you know that in psychiatry or in any subject, it's quite common that we can't start from a particular point that everything would be so simple. Okay, just like we started with history taking at that time. Yes, you should know hallucination and delusion. But if you don't remember exact hallucination and delusion, but you must have heard a little bit about it, and we can consider that hallucination is means perception without stimulus. There is nobody around but he is hearing voices. That is hallucination. Okay. Suspicious of a family member, that is called suspiciousness or delusion. That is called delusion. So this patient is having 6 month history, 6 month suspiciousness, 3 month hallucination. Why I am repeating it again and again? You will find so many questions on it. Okay. Yes. In second time interview, he told more or less same. Now I explain what is the C. C for chronological. Chronological means sequence. Chronological means sequence. Means he told the symptoms in a sequence. Means 6 months back, 6 months back, patient has suspiciousness. 3 months back, patient developed hallucination. So this is chronological. Chronological means patient should give the history in a sequence to say reliable. Coherence. Coherence means logically connected. Logically issue. Let me ask. I think it's resolved now. Okay. Should I continue? I don't know. Is it okay now? Okay. Okay, dear. Yes, consistency means yes, what happens when patient is admitted in ward? Yes, suppose a patient comes to you, you admit the patient in ward and you take history multiple time. In psychiatry, we take history from the patient and informant 2, 3, 4 times. So every time he should tell the same history. Yes, suppose the informant father is manipulating the history, so every time he will give a little bit different history. So if event is true, then you tell more or less the same thing. But if you make a false story, you will deviate from the main topic and every time you will change the history. So that's why the person who is telling history should be consistent. Every time history should be same. Got the point, Dharmesh? Okay, we can do two things. Either we can give answer at the same time. Yes, just like yes, you ask question about color of cocaine. Yes, and yes, but I will show you the picture, that would be better. Okay, then it would be. It's actually there is a little bit confusion among students why I'm restricting the discussion, because otherwise I will have to discuss about opioid, heroin. Heroin is white color. Yes, I will. Yes, I have given in handouts also. Yes, and sometimes the student get confused that chitta. Chitta word is used for, chitta means white. Yes, chitta is white. They get confused with that cocaine is also whitish color. So sometimes we get confused that chitta is cocaine. No, chitta word is used for opioid. Okay, so but Urta Punjab, sometimes they get confused by that movie. Okay, so we will take care, don't worry. Whatever your doubt, I am pointing out just to not to interrupt the flow. I will do that. Otherwise, I will take care of all your doubts, don't worry. And the last of class, I will remain seated, and whatever doubt you have, I will resolve and then I will leave. Okay, yes, please do reply कि how many of you don't know Hindi? Yes, I can use Hindi. I am very comfortable with Hindi. Mehboob, so okay, Dharmesh, English fine, sir. Okay, we can use a little bit Hindi, but this will interrupt the. Okay, okay. So what we can do? Okay. So we can use a little bit Hindi, but the only thing I will use, if I repeat, then I will use Hindi. Otherwise, okay. So few persons are from yes. So okay, Anand, Vasant, we can do a mix and match. Okay. Don't worry, dear. We will take care of all your queries and all your problems. Yes. In between, yes, I will try to little bit. Okay, what we can do, I will use a very light English, is RM, nothing else. Okay, okay, dear. Yes. Oh, don't worry. This is the initial part. This is a boring part, I know. And but they have asked recently questions on it, and there are so many questions in market, market in the sense in different exams on this topic, and this is not touched anywhere. So that's why I am telling you. It's a little bit complicated, I know, but don't worry. After some time, it would be smooth. Okay. Second time interview means every time you ask the patient, you take the history, every time patient's relative will give same history. Then we say it is consistent. Closeness means stay with patient during illness. Means if if the informant is staying with the patient during illness, यानी जब पेशेंट बीमार हुआ तो क्या इन्फॉर्मेंट पेशेंट के साथ था? When the patient was developing illness, yes, informant should stay with the patient. That is called closeness. Now, I ask you a question, then I will move forward. I have discussed till now chronological, coherence, consistency, closeness. 4. Coherence I have not explained in this example, but don't worry. Logically connected, yes. If I ask you this question, this is a girl having this psychiatric illness. Yes, I have solved 6 questions by this example only. You will appreciate soon. Yes, I am going to tell you. Don't worry. Each and every line has question. The purpose, yes, this is very well planned material. Each and every point has question. Whenever I am repeating twice, thrice, means it will be used in many questions. Okay, now I ask you question. Yes, please do reply as much as possible. A 23-year-old girl married 2 years back, living with in-laws, was brought by her father. Yes, her father gave history, this. This father is informant. In this scenario, father is informant. Father is informant. Father is reliable or not reliable? Reliable or not reliable? Yes, if you think reliable, you write R. If you think non-reliable, you write N. If reliable, okay, good. If not reliable, why it is not reliable? Why it is not reliable? Yes, Dharmesh, which criteria, good, B19, which criteria is not fulfilled? Which criteria is not fulfilled? Yes, good. Yes, because closeness is not there. This question has been asked 2 times, once AIMS, and there is a controversial question also. Okay, that's, yes, Chirag, it is not reliable. Yes, let me explain. Yes, let me explain. In this question, this father gave history in a sequence. Yes, good. Kartik, Gitika, good. Yes, good. Yes, this patient is having, yes, history, giving history in a chronological way, in a sequence, 6 months, 3 months. Every time gave same history, means consistency. It is quite logical. What does it mean, quite logical? Yes, psychiatric illness develop like that. Psychiatric illness, previously sleep will be disturbed, then suspiciousness will start, after some time hallucination start. So this is logical. You will learn these things later part of our discussion. So this is quite logical. Suppose patient comes, Dr. Saab, the patient started having hallucination. Sometimes he becomes so violent and start hearing hallucination. For 2 months he never heard any hallucination. It becomes illogical. How can it be possible? For one day he was having so much of aggression, so much of hallucination. For 2 months he was not having. Means this is illogical, not logically connected. Clear? So this is logical. Closeness means patient is not staying with her father because she is staying with her in-laws. So you can't say father as reliable because father is not staying with the patient. Clear? During the illness. What about concern? Yes, I will discuss. Before going to concern, yes, now I told you that I will discuss so many questions from this. Yes, you will write, this is a typical case of schizophrenia. This is a case of diagnosis is schizophrenia. I know that I have not discussed schizophrenia till now, but you have read this statement so many times, you will remember this is a typical case of schizophrenia. Now, how many questions? Yes, I will discuss in detail, don't worry for the timing. In schizophrenia, age is usually 23 around, means adolescent and young adult. Schizophrenia age is adolescent and young adult. Question is asked. The duration criteria of schizophrenia is 6 months. Duration of symptom should be 6 months. Yes, I will discuss schizophrenia in detail, but if we have used anything, we will use, yes, we have read anything, we will use it in many questions. In schizophrenia, there is delusion, suspiciousness, there is hallucination. If 2 symptoms for 6 months, yes, this is schizophrenia. Few more questions at this time I am not going to tell you, later on. Okay, just to tell you this is schizophrenia. Then when I will discuss schizophrenia, I will ask you to recall this. Okay. My purpose is that after completing my class, I can complete my class in 12 hours, 13 hours, but I am taking more time. The reason is that after completing my class, you should be able to solve all questions, even if you don't revise. Okay, you try all the questions and you will solve each and every question on any exam. Okay, I am going very slowly. I will increase speed at appropriate time. Okay, now I leave this example for the time being. I am going to question which was asked in AIMS, which is controversial. Okay, reliability of information. This question was asked in AIMS. This can be repeated. Reliability of information about patient provided by informant depends on all except. Yes, option A, biological relation. We read from the last. Duration of stay with the patient. Yes, duration of stay with the patient means closeness. Yes, depends. Consistency of information. Yes, consistency of information. Now option left. Please do reply. Any answer you want to give? Yes. Yes, biological, good, relationship and educational status. Biological relationship, educational status. Answer is B, good. Answer is B. Yes, biological relationship has some role. Means if biologically related are there, definitely they can give little bit better history. Good. But if I add option E, observation skill. This is memory based question. So few students told that sir, the option was not biological relation, the option was observation skill. Now what would be the answer? Please do reply. Now what would be the answer? According to few person, yes, few person says that the answer should be observation skill, but I say no. Answer will remain same. Yes, observation skill. Yes, you will find that this is important. Yes, good, same B. Yes, observation skill is criteria according to Neeraj Ahuja. I know Neeraj Ahuja is not a standard textbook for PG entrance exam, but even then, yes, you will consider that in at least in one textbook it is clearly written that observation skill is also important for the reliability of informant. So Neeraj Ahuja. Other than that, you can easily understand few questions are asked that if a patient is having mental retardation, if a patient is having mental retardation, is mentally retarded patient means IQ is very low, he can't observe things, so he is not a good informant, not a good informant. Children, yes, are not good informant. So these 2 points are also important. Yes, education status, you can easily rule out education status, as you know that if we consider educational status, then most of time you will not be able to get the history in daily life, okay, because in our society in rural area most of the patients are not having good educational status. It's not the education, it is the observation skill which determine the reliability, okay. If anybody can observe what is the changes in behavior of patient, yes, if anybody can observe what are the changes in the behavior of the patient, then you are a good informant, okay. Now, last C is concern. Last C is concern, genuine concern. This is very important legally. Let me give you a very good example. This question has been asked. Yes, the man's pattern question. Yes, a 40-year-old man has become suspicious of his wife that she is cheating on him for 3 months. He is having suspiciousness for how much duration? For 3 months. Otherwise, he is well-behaved gentleman, polished shoes, talking nicely. Yes. His wife brought him. His wife brought him. Okay, so till now we will not suspect anything. A 40-year-old man becomes suspicious of his wife brought him. Till now we say okay, he might be having true suspicion, he might be having, yes, some delusional disorder. But you came to know, we always take legal history, divorce case already filed. When we come to know divorce case, thank you dear, already filed, then you will suspect that this lady might be having some means she want to declare her husband as having psychiatric illness. She want to get divorce easily. So if I ask you, his wife is having, is a good informant in this case or not? Reliable informant or not? No, she is not reliable. Suppose this, you are sitting in OPD and this patient came to you. Patient says that Dr. Saab, you know my wife is cheating on me. She is not faithful to me. Wife says, no Dr. Saab, no, he is lying. I am very innocent. I have no affair. Then what you will do? What you will do? Yes, please do reply. Who is correct? How you will recognize? Yes, first thing you will do, this question was asked, first thing you will do, you will ask the patient or informant to bring family member, other family member in next sitting. One thing we can do. If nearby, yes, you can call and can ask to come. Second thing, they said that no, dear Nitin, we will not follow the patients. Patient might be speaking false. He might be having suspiciousness. Yes, only divorce case will not say that we will always follow the patient's thing. Okay? Yes, this may be the genuine concern of the lady. Okay, so we will ask the family member. Sometimes family member comes and the mother-in-law says that Dr. Saab, my son is has gone mad. My wife is very innocent. She is very quite good. She is no, she her character is very good. Means one thing. Second thing, we have some psychodiagnostic test. What I said? We have some psychodiagnostic test with us which can determine, yes, what is the psychopathology going on. Other than that, we can talk to the patient and we can extract the truth. Yes, we will admit the patient, we will observe the patient, we can admit the patient and we can observe the patient, what is the behavior, what is the exact psychopathology, and we can apply many tests. Okay, but in this informant, we will think not reliable because of which issue? Concern. Okay, got this? So I took little bit more time in this part because few controversies are there. Recently question has been asked and this has been asked in Apex Institute recently. So this becomes important question. Okay, and these are the clinical questions which are present in, which are asked in many MLE pattern and MRC psych pattern question. So this is same questions may be asked in your exam. Okay. So now we move to next point. Yes, you must have taken history in medicine, surgery. We take personal history, birth and development history, behavior history, school history, occupation history, menstrual history, everything we know. Except one point, that is pre-morbid personality. Morbid means pathology, means abnormal, means disease. So pre-morbid means before the disease, what was the personality? Pre-morbid personality, what was the personality before illness? Morbid, or you can say illness. Means what was the personality before illness? Personality before illness. Personality is formed in, yes, all these are questions, formed in adolescence. Yes, question. Okay, now I give you a question, yes, and I will ask, yes, I expect correct answer from you. A 7-year-old boy, or you can say 12-year-old boy, was brought with history of hyperactivity, roaming around in the class, disturb other student. Yes, this is repeated. Inattention, impulsivity, blurts out answer before completion of question. Out of the following, which is not relevant part of history taking? Sometimes what happens, we start reading question and we start making diagnosis, but it is a rule in long clinical question when you are having less time. Yes, you must have heard many times by many senior faculties that whenever you read, you find a very large question. Yes, first of all, read the option. If you read the option or first and last line, you will find many times that the intermediate things are irrelevant. Okay? Yes, good. Alphaz, Very good. I'm really happy that, yes. So, good. So, in this patient, the age is 7 years. What about occupational history? Yes, occupation history, yes. Childhood, yes, occupation history, childhood, labor is quite common, childhood marriage is quite common, legal history we should take, but personality is formed in adolescence. Personality is formed in adolescence, so answer would be premorbid personality. So in 7-year-old boy, 20-year-old boy, personality is not formed till now. Personality is not formed till now. In place of premorbid personality, in children, we use the word temperament. Temperament. In children, we use the word, very good. Gitika, Kartik, Nitin, B19. COVID-19 I have heard, but not B19. Yes, but it's quite good name. Sindhu. Okay. Yes. So this is about temperament. Not much question, but I have given you ADHD history. I will use each and every line. Again, I am saying, I will use each and every line. I will come to this point again, and you will remember whatever age I have taken. Yes, just like this question. Don't remember. Just I am telling you, this question is a typical example of persistent delusional disorder, PDD. This is an example of which disorder? Persistent delusional disorder, and the age is 40. Question is asked, what is the age of PDD? Middle-aged man. Yes, in PDD, everything is normal. Only and only delusion is there. So each and every point will be used in question. So don't worry. So whatever I have given in your handouts, just like in this is a typical case of ADHD. Previously the age criteria of ADHD was 7 years. Now the age criteria has changed to 12 years. That's why I have taken 7 and 12. Okay, these are typical picture of ADHD. Okay, so each and every point has validity. Now, please do reply. Are you comfortable with the speed or method? Okay, I know that I can't go with Hindi, but my English is so simple because I am from Hindi medium, and I manage anyhow to speak in English. Okay, but yes, so my English is very simple. So you will not have problem in understanding this simple English. So other than that, yes, speed, pattern, if you are comfortable, then we will continue. Yes, we can later on we can think of speed, but I have, yes, good. Thank you for your reply. Okay, now previously, Nitin, I will try, Nitin dear. And now we are recording English also. I think you will get access to English eGurukul. Okay, so let me try. Okay. But what happens when we try to speak in Hindi? Many times we forget, yes, which topic, which statement has been repeated or not, and the person who is, yes, who is, who don't know Hindi will suffer. Okay. But Nitin, I will try, yes, whenever you have any doubt regarding any topic, so you can ask me, message me personally also, and I will clear your doubt. Okay, dear? So, I am always available for solving your queries. Okay? So, whenever you have any issue regarding your medical problem, regarding your, definitely I'm a psychiatrist, so I can handle your stressful situation better. Okay, so and I am also available to my students. So Nitin, you can message me personally, whatever you are having problem in understanding, then I will reply you. I will give you voice message, but don't worry, okay? Yes, psychosis and neurosis. There was a concept, psychosis, neurosis. There was a concept of psychosis and neurosis, okay? But this concept is no longer used. Even now, questions are asked. Let me tell you this example. Yes, this is a girl who has suspicion my family member wants to kill me. She came to you. You ask her, okay, don't worry, I will give you medication, you will be okay. Okay. After taking medication, you will be okay. She would say, Doctor Sam, what are you talking about? I am not ill. I am not ill. I have no illness. Why are you giving me medication? I have no illness. My family member wants to kill me. I am requesting you to save me. Means she is not aware about her illness. What I said? She is not aware. Yes, this girl is not aware about her illness. Not aware about her illness. कई बार वो कहेगी कि डॉक्टर साहब आप भी मिल गए. You have been purchased. Yes, you also want that. You also think that I am mad. I am not mad. They are mad. They want to kill me. They want to take my property. Means she is having schizophrenia, but she is not aware about her illness. So we will say she is not having insight. Insight means awareness about illness. Direct question is asked in your exam. What is insight? Insight means awareness about illness. And she would say, yes, that my family member wants to kill me. Yes, this is the fact, means she is not aware about her illness. So insight is absent, and you will use the word psychosis. In psychosis, insight is absent. But if I take a patient of depression, neurosis, so psychosis example just like schizophrenia, neurosis just like depression, okay? In depressive patient would come to you, Doctor Saab, I am having sadness of mood, decreased appetite, unable to sleep, low interest in daily activity, I have so many problems, not doing anything, my mood remains so sad, please help me out, I am having this problem. Means he is aware about his illness, means insight is present. So example of neurosis, depression, patient is aware about his illness, will come to you, insight is present. While psychotic patient, psychosis, insight is absent. Clear? We found that many times, yes, why we have removed this classification? Because sometimes you started treatment of schizophrenia, this girl you started treatment, now she became okay, means she is treated. After 4 months, 5 months, she has improved. Now she comes to you, she says, Dr. Saab, you know that I am on antipsychotics, yes, I am on olanzapine, I am quite well now, but my weight is increased. Please give some other drug for my schizophrenia. Means she is aware about her illness. So we found that even in psychosis, you can say insight may be present. So this is not a good criteria. This is not a good criteria to differentiate between psychosis or neurosis. So now we say, yes, this is not a very important criteria. Better criteria is delusion and hallucination. Delusion and hallucination are present in psychosis, absent in neurosis. What is contact with reality? Contact with reality means patient is not, yes, aware, he's not knowing the reality that in this schizophrenic patient nobody want to kill her. The reality is that nobody wants to kill her, but she is not aware with the reality. She has no contact with reality. Means contact with reality in psychosis absent, neurosis present. So if question is asked what is the difference between psychosis and neurosis, and they gave option A insight, option B delusion, what would be the better answer? Please do reply. If question is asked what is the difference between psychosis and neurosis, option A insight, option B delusion, better answer would be, please do reply. Yes, good. The answer would be delusion. Good. The answer would be delusion. Okay, insight, they have recently asked question in AIMS on insight. Okay, so and this is quite commonly asked topic, so we can't skip. Good. Yes, I am really happy that I am getting the correct answer. Good, Chirag, Himani. Yes, what is insight? Insight is awareness about illness. We found that they are grading in insight. Just like I told you, this lady, this girl, initially she was saying that I am having euphoria. Yes, good. I am having no illness. And after that, she started saying, Dr. Saab, I am having schizophrenia. Means insight level changes. So we found that insight is having 5 level. 1, 2, 3, 4, 5. Sometimes in few textbook it is given 6 levels. But we follow, most of the Apex Institute in our India are following 5 level. So we will consider 5 level. Okay? And no need to worry, the questions which are asked, they are asked in such a way that if you remember 5 level, and even if the 6 level question is asked, you can easily solve. Don't worry, I will tell you in such a way. First level is yes, complete denial. Just like this, the girl was saying that I am having no illness, that is called complete denial, means level 1. Level 1, or sometimes we write like this, 1 by 5. 1 by 5 means out of 5 level first. Some of level 2, some awareness but denying at the same time. No question till now. Let me tell you, simplify. Suppose this girl says, Dr. Saab, I hear some voices. Means some awareness. I hear some voices but denying at the same time. But this is not illness. Everybody hear voices. You hear voices. I hear voices. He hear voices. So everybody is hearing voices. What is abnormal in that? Yes, definitely I hear voices. Means 2, yes, no. Yes, no. I do remember like this. Yes, no. Yes, I am hear voices, but these are not, this is not illness. Level 3, awareness of being sick but attribute to external or physical factors. This girl says, Dr. Saab, I hear voices, but this is not medical illness. This is not psychiatric illness. I am not mad. I am not having schizophrenia. Yes, my neighbors are emitting radio waves. whenever they emit radio waves, I hear these voices. This is not my illness. This is the radio waves. Means awareness about illness means some abnormality is there, but attribute to external factor. My neighbors are emitting rays, or some physical factor. Means, Dr. Saab, I am not ill. I am not mentally ill. I know I hear voices, abnormal voices comes in my ear, but when my sugar level fluctuates, then these voices come. I am not mentally ill. I am not psychiatric patient. Means physical factor. Yes, means physical factor. When blood sugar fluctuate, I hear voices, otherwise not. External factor means my neighbors emit radio waves, that's why I am hearing voices. Level 3. No question on 2 and 3 till now, but 19 AIMS they have asked question on insight. Other than AIMS 19, many times they have asked question on insight, so this topic becomes important. Clear? Level 4, intellectual insight. Intellectual, just like we are talking intellectual level, till now we are at intellectual level. Yes, if patient says that Dr. Saab, I know that I am having schizophrenia. You said, okay, you have schizophrenia, take your medication on time, lie down on the bed on time, take good sleep of 7-8 hours. He would say, okay, Dr. Saab, okay, but will not follow your command, means will not change his behavior. Yes, means intellectual insight means insight is present, but no change in behavior, no change in behavior, no behavior modification. Emotional insight, this is the highest level of insight. Yes, emotions are very important thing. Just like I usually say, I remain connected with my student emotionally. The reason is that, yes, if I could connect you emotionally, definitely we are not face to face, but it is not required. Yes, I'm a psychiatrist, I know that what are the importance of emotion in our life. Emotion regulate all our energy. Yes, when I will discuss Sigmund Freud, when I will discuss other aspects of psychiatry, then you will realize that how we can improve ourselves with the help of psychiatry. Our performance, how can be improved with the help of psychiatry. Psychiatry is a very good branch, okay? Evolving branch also, but there was a stigma about psychiatry, that a psychiatrist go mad, they go crazy, but it's not like that. Yes, if you use psychiatry for your well-being, definitely you can improve yourself, okay? And you know that I have deliberately taken 20 hours for psychiatry. The reason is that I want to, yes, you will appreciate soon, not now. Yes, when I will discuss Freudian theory, I will discuss few aspects of psychiatry, then you will realize that how we can change our life, how we can change our thinking process with the help of this study material only. Okay, so for the time being, emotional insight, yes, when patient is emotionally connected with us, yes, you say, or patient would say, yes, sir, Dr. Saab, I am having illness, I will take medication, and he do appropriate behavior. Means insight present plus change in behavior also. So this is the highest level of insight. Multiple time they have asked this question, yes, what is the highest level of insight? You will say emotional insight. I usually say emotions are very important in our life, okay? And emotional memories are much stronger than any other memories, okay? So for the time being, yes, 1 by 5 complete denial question has been asked. Fifth, 5 by 5 question has been asked, highest level. Yes, intellectual insight, you know. Yes, second, third. Even if you don't remember, what we do, sometimes we segregate. Even if you don't remember, it's okay. Rarely ask question, okay? But this definition, question, okay? Psychosis, neurosis, delusion and hallucination, question, okay? This is recently asked question. Now I'm going to touch a very important topic and so-called controversial. Yes, you will find that at many places that these are controversial questions. But no, those are not controversial questions. They are conceptual questions. Yes, I will explain. Yes, ICD-11 has come but not being followed. Yes, it was supposed to be, yes, implemented since 1st January, but not being followed at any place. So we expect, yes, as previously they have asked recent changes in ICD-11. So I will touch that part also. But for the time being, you will remember all the features of ICD-10 and what are the changes I will mention. Okay, so no need to worry. Remember ICD-10 and what are the changes will point out. That would be sufficient to solve all your questions. Okay, the reason is that I am telling you ICD-10 because synopsis has come. The latest edition of synopsis has come 8-9 months back, and even in that test book they first time included ICD-10, not ICD-11. Okay, so chances are there you will remember this ICD-10 criteria, and what are the changes you will remember, I will tell you. So ICD-10 what is ICD-10? International Classification of Disease, 10th edition. This is published by WHO. Published by WHO. In ICD-10, Chapter 5 deals with psychiatric disorder. So we found that all the psychiatric disorders we have, all these psychiatric disorders are divided into these groups. Okay, means F0 to 9, 10 to 19 means F4 functional. F4 functional. F4 functional. What does it mean? Yes, let me tell you in a simplified form. One is organic. One word is organic. One word is functional. Yes, what is the difference? Suppose a patient comes to you having hemiplasia, hemiparesis, paraplegia. This patient died. After death, you opened the skull. After death, you opened the skull. You found that in brain there is thrombus, there is ischemia. Well, means some abnormality you found. Means there is some change in the anatomy of the brain. We said this is organic disorder. But a schizophrenic patient, just like I told you that this is schizophrenic patient, this is a girl having schizophrenia, abnormal behavior. Suppose this girl died. You opened the skull. You found that all the structure of brain was normal. All the structure of brain was normal. So you said that there is no change in the anatomy of brain in schizophrenia. There must be change in the function of brain. There must be change in the function of brain. That's why schizophrenia is a functional disorder. Means if you find a change in the anatomy of brain, that is organic disorder. Again I repeat, if you find a change in the anatomy of brain, that is organic disorder. If you don't find any change in the anatomy of brain, you will say the abnormality must be there. Abnormality is not in the structure, abnormality is in the function. So functional. So psychiatric disorders are functional disorder means disorder of the function of brain, not the anatomy of brain. But this classification is no longer used. Yes, every time I'm telling that this classification is no longer used, psychosis, neurosis, but this is the fact. Organic, functional, this is not used now, but this is the fact, but questions are asked. So psychiatric disorders are disorder of the function of brain. Organic disorder are disorder of organic means of anatomy of the brain. You understood this concept? Okay. Now we found that organic mental disorder, meaning any mental disorder in which there is change in the brain structure, just like delirium, just like dementia, they are grouped between F0 to F9. Means each disorder is given a code. Each disorder is given a code. So if I ask you what is the code of delirium or dementia, I say no need to remember the exact code. Just remember the code of delirium and dementia lie between F0 to F9. F0 to F9. How to remember? Yes, I usually say, yes, 0 means O. 0 means O. Okay. So organic mental disorder lie between 0 to 09. We found that many times you must have seen the patient taking substance. Psychoactive substance means alcohol, tobacco, opioid. If a person is taking alcohol, tobacco, cannabis, opioid, yes, it's quite common. Just like cocaine. Yes, I told you that cocaine, there is a cocaine use lead to tactile hallucination. Means these psychoactive substance means alcohol may produce psychiatric symptom. If alcohol, cocaine, opioid produce psychiatric symptoms, these psychiatric disorder due to these substance use are grouped between, they are coded between F10 to F19. Don't ignore this point. I am going to solve a very important controversial question, not only in PG entrance exam, in your MCI this question has been asked 2-3 times, and most of the places you will find the question is controversial. But I will explain this is not controversial, this is conceptual. Yes. So alcohol, tobacco, opioid, cocaine induced behavior disorders, mental disorders are coded between F10 to F19. I usually say 1. 1 is A. In ABCD alphabet, A is the first letter and 1 is the first. So 0, O, A means most common substance we use is alcohol. So yes, we discuss is alcohol. Questions are asked on alcohol. So A 10 to 19 means substance code lie between 10 to 19. Schizophrenia, psychotic symptoms, psychotic disorder just like schizophrenia. Psychotic disorder, I just told you, psychotic disorder just like schizophrenia. As for psychotic, as for schizophrenia, as for second means all psychotic disorder code lie between 20 to 29. Yes, all mood disorder means depression, yes, recurrent depressive disorder, mania, all lie between F30 to F39. Yes, if you see M, I always rotate M and it looks like 3. It looks like 3. So mood disorder between 30 to 39. Okay, I usually say if you remember these 3, 4, 4, that is sufficient to solve most of the questions. Yes, I want your answer. Which category of ICD is associated with schizophrenia? Yes, please do reply. This question was favorite question of NB once. Yes, they ask 10-15 questions. Yes, so you know schizophrenia is a psychotic disorder. Psychotic disorder lie between F20 to F29, and only one option is having only one option lie between F20 to F29. Yes, F07 is organic mental disorder. Organic. F07 is organic mental disorder. F14 is substance use. Substance use. Yes. F33 is, yes, that is mood. Good. Clear? So only you will find that if you don't mug up each and every code, just remember the group and you will solve the question. They will give only one option lying in a particular group. Okay? Let me give you another example. These are all taken from NB pattern. Okay? Which category of ICD is associated with depressive disorder? Depression is a mood disorder. What is the answer? Depression is a mood disorder. And mood disorder M3. Yes, good Dharmesh. M3 means F32. Only one code lies, means one option lie between, yes, F32, 39. Clear? So answer is D. Clear? Good. So this is the way how you will solve the question. This is the way how you will solve the question. Now yes, now I am going to a controversial question, so-called controversial. Before going to that, there is hierarchy system. You will not find this word hierarchy in any textbook. This is the clinical application. Yes, I have learned from my seniors and faculties. Yes, there are, yes, hierarchy system. What does it mean? That if a patient, yes, I will tell you why hierarchy is important. If a patient is having both organic symptoms, symptoms of organic disorder and symptom of schizophrenia, you will prefer to mark diagnosis of organic mental disorder. Again I repeat, if you find a person having symptoms of organic mental disorder and schizophrenia, so in hierarchy, organic mental disorder lies above. So first priority is given to organic, second priority is given to substance, third priority is given to schizophrenia, fourth priority mood. Let me explain in a simpler way. Then I will move to the difficult question. Suppose a patient comes to you. What is the reason that this hierarchy is there and how questions are asked? Yes, all these are questions. I am not wasting your time. Whatever I am telling you, all questions has been asked. If, yes, if a person comes to you, he is taking alcohol if a person is taking alcohol for 5 years, now he comes to you and say, Dr. Saab, I am sad, I am decreased interest, I am having decreased interest, decreased sleep, decreased appetite, I am sad, decreased interest, decreased sleep, decreased appetite. Okay? Means symptoms of depression are there. Symptoms of depression are there. He want to, yes. So now you can say that these symptoms may be due to alcohol use. Many times we have seen that the person who is taking alcohol for such a long time may develop depressive symptoms. So these symptoms of depression may be due to alcohol, or this may be diagnosis may be depression. Now what should be your diagnosis? It should be alcohol induced depressive symptoms or alcohol induced mood disorder, or it should be diagnosis should be depression. What should be the better? Yes, I don't go in hierarchy. According to hierarchy, you will say, sir, hierarchy, alcohol is on the above, means alcohol is here. According to hierarchy, alcohol is here and mood disorder is here. So we should give preference to alcohol. So you will say this is alcohol induced symptom. Yes, we will prefer to mark diagnosis as like this. But what is the logic? Why we have considered like this? This is also a question. Means if this patient is taking alcohol for 5 years and is having depressive symptom, fulfilling the criteria of depression, and you thought that he is having depression. You thought he is having depression and he is also having substance use disorder, alcohol disorder. Okay, I am talking in a simpler way, not in so scientific, so avoiding the scientific words. So in this patient, if depression is there, we will discuss. If you diagnose a patient having depression, you will treat the patient for 6 to 9 months. How many months? 6 to 9 months antidepressant. We all know, or we will discuss, कि if patient you diagnose having depression, you will treat the patient with antidepressant for 6 to 9 months. But sometimes we found that these symptoms are not depression. These symptoms are due to chronic alcohol use. You will treat the alcohol, means if you will stop alcohol and start treatment for alcohol, we found that in 15 to 30 days, these symptoms resolve spontaneously if these symptoms are due to alcohol. Means you treated the alcohol and patient's symptoms recovered. So if you have diagnosed, suppose you diagnosed this patient having depression, you would give treatment for how many duration? 6 to 9 months antidepressant. But actually in this patient, many patients don't require antidepressant, they require treatment of alcohol. When you will give treatment of alcohol, patient would be treated for alcohol dependence and these symptoms will automatically go in 15 to 30 days. There is no need of antidepressant. That's why we say if a patient comes to you having both alcohol and depressive symptom, we consider first as these symptoms may be due to alcohol. If we will treat the alcohol, these depressive symptoms will resolve spontaneously. There is no need to give antidepressant. And yes, understood? Good. No need to give antidepressant. This is the reason, yes, we consider organicity and alcohol in priority to antidepressant, priority to depression. Now, question is asked. Yes, you will find all these clinical question in your exam, means in your, different platforms and previously asked questions. Now, one more example. You all know hypothyroidism is a very common cause of depression. Hypothyroidism is a very common cause of depression. If a lady comes to you having depressive symptom, you don't make diagnosis of depression immediately. You check thyroid function test. If hypothyroidism is there, then you will treat hypothyroidism. You will not start antidepressant. You will start hypothyroidism. Many times you will find that as you treat hypothyroidism, these depressive symptoms will go within 1 month, 2 months. So if you misdiagnosed this lady having depression, then you will continue antidepressant for how much duration? 6 to 9 months. But I have told you that yes, this patient would not be treated by this antidepressant because those depressive symptoms are due to hypothyroidism. How question is asked? If a patient comes to you having depressive symptoms and you diagnosed having hypothyroidism, then what you will do? Option A, start antidepressant plus thyroxine. Yes, please do reply. A patient is having, a lady came to you having depressive symptoms, yes, and hypothyroidism came to you. What is the treatment? Option A. What is the initial treatment? Option A, yes, thyroxine plus antidepressant. Option B, antidepressant. Option C, thyroxine. Yes, good Dharmesh. Yes, first of all, you will start thyroxine if euthyroid state is maintained. Listen carefully. Euthyroid state is maintained, even then depressive symptoms are there. So there are chances that the patient is having both of these diseases together. Okay, means patient is having hypothyroidism also and depression also. Even after giving thyroxine, patient is not improving, means euthyroid state is maintained, patient is not improving, means this suggests that patient was having both hypothyroidism and both depression. These depression were separate diagnosis. There are chances. So, but they don't go in such a depth for you. So you will remember the concept and you will solve all the question. These are the most difficult questions, one of the most difficult question which has been asked, and these are little bit controversial at few places. Don't get confused. I am giving you the hierarchy system, and yes, now I am showing you, yes, let me see that. Yes, now I am showing you. Don't turn your pages. Okay, just listen the question, and yes, it is given in your handouts, and appreciate what is the beauty of psychiatry. Yes, this is so-called controversial question. Now you will give me answer. Okay. A 67-year-old male, dementia. Yes. Again, I am telling you that this is the introductory part. It may be little bit difficult initially. Yes, I usually do like that. But gradually, yes, psychiatry would become simple. It is the most difficult part I start with. So further discussion would be very simple for you. Okay? But this will not help you to solve psychiatry question only. Neurology question will be solved by this concept also. Okay? In dementia, the age is usually 65, more than 65. This question is asked. Yes, a 67-year-old male brought to OPD with 1 year history of illness characterized by marked forgetfulness. In dementia, there is forgetfulness. So I am writing the point suggestive of dementia. Visual hallucination. Yes, I write here visual hallucination. Means hallucination is seen in schizophrenia. Suspiciousness means delusion, hallucination for more than 6 months are known as schizophrenia. Yes, we have discussed. Yes, for the time being, I will discuss criteria of schizophrenia in detail. For the time being, I told you that if suspiciousness and hallucination for more than 6 months or 6 months, diagnosis may be schizophrenia. Yes, Dharmesh, Alfez, Karthik, Nitin has given the answer B19. Yes, please do reply. Vishal, what should be the answer? So, diagnosis of schizophrenia can be made by hallucination and delusion, suspiciousness. Okay, personality decline. This personality decline, I take different color. Personality decline may be present in dementia, commonly seen in dementia. Yes, personality decline may be seen in dementia, personality decline. Poor self-care. Personality decline may be seen in schizophrenia. Personality decline may be seen in schizophrenia. Poor self-care may be seen both in schizophrenia and dementia. Progressive deterioration of memory is seen in dementia. MMSC score is 10, seen in dementia. Diagnosis is. Now this become controversial. Everybody says that in this question has both diagnostic criteria or symptoms suggestive of dementia and schizophrenia. Good. Dharmesh, K. Arjun, Himani, yes, B19, rethink about it. Rethink about it. Hierarchy system. This became controversial. Yes, because they don't apply hierarchy system. Yes, if I ask you, dementia is, yes, organic mental disorder, and in hierarchy it is above the schizophrenia. And if a person is fulfilling the criteria, yes, good B19, Karthik, yes, good, yes. So This is not a controversial question. They want to check your knowledge of hierarchy. If you know that in hierarchy dementia is above, why I say dementia? Yes, let me explain logically. Yes, in this dementia may be there, schizophrenia may be there. Answer, I will prefer to mark A according to hierarchy system. Then you will ask me, sir, how you will explain the symptom of hallucination and suspiciousness? Then I would say, yes, this is quite common in dementia. In dementia, there may be visual hallucination. Yes, I will discuss. In schizophrenia, auditory hallucination are common, not exclusive, common. But if visual hallucination are there, visual hallucination are common in organic disorder. So first thing, visual hallucination are common in organic disorder. So one thing, suggestive of dementia. Second thing, in dementia, if a person forgets, what happens? Yes, for a person forgets, he keep his money at one place and he forgets. Then he think that somebody has stolen my money. My daughter-in-law has stolen my money. My son has stolen my money. Suspiciousness. He take food in the morning and after 1 hour, 2 hour, he forgot that I have taken food. Sorry, in the morning he take breakfast. So I don't remember. I don't know what. Mehboob, no Mehboob dear. Yes. So sorry, what I have spoken I don't remember. But let me repeat. So this dementic patient took food, took breakfast in the morning, but forgot. I have not taken. My daughter-in-law has not given me yes food. So he would become aggressive. Yes, he don't remember. He would say, you have not given breakfast till 12 p.m. So you want to kill me. You want to make me hungry. You want that this old person should die. Means he start becoming suspicious. He becomes started aggressive. He don't take care of self. Poor self-care. So these are called suspiciousness and visual hallucination. Hallucination and suspiciousness are called behavior and psychotic symptom. What I said? Behavior and psychotic. You will read in neurology in detail. Yes, behavior and psychotic symptoms of dementia. Because if symptoms are there, you must explain that. Yes, at this time I am explaining, but in your exam, no need to think so much. Yes, I will give you the key points also. Yes, initially I am giving you in a little bit descriptive manner. Then I will tell you how a single word changes the answer. A single word, you will catch a single word and you will find the answer. Okay. So this is behavior, means you can explain suspiciousness, you can explain visual hallucination, suspiciousness by behavior and psychotic symptom of dementia. So in this question, yes, answer is dementia, and this suspiciousness is behavior and psychotic symptom of dementia. What is personality decline? Yes, I will discuss with dementia also. Yes, few points, but for the time being, yes, sometimes you will find there was a person, professor, developed dementia. He is a very nice person. Yes, he is very well behaved gentleman, but now he started cracking a double meaning joke. You will say his personality is declined. Previously, he used to remain well maintained, yes, combed hair, but now he is not maintaining. Yes, that means this is a decline in the personality. So, means higher cognitive functions are affected. Yes, I will discuss that with the higher mental function, higher cognitive function. Clear? So hope you are understanding these things and you are getting. Yes, recently I found not only in psychiatry, other subjects also, you will find that even a single word is changed and the answer is changed. So you will appreciate this, that even a single word change can change the answer, and I will show you in the next discussion. So it is 11, 2 hours. We should take a short break of 15 minutes. Short break of 15 minutes. Vishal, I will discuss personality decline again with higher mental function. So for the time being, we take a short break of 15 minutes. Then we will continue with mental status examination. Okay, more and more interesting part. Now the further discussion would be little bit more lively, more interesting. So we or if you want, we can do few things. Yes, we can do few things, or should take a break. Please do reply. I think break, we should take a short break.